So the question that's being answered is, what is the optimal regimen to be considering post intra-articular knee PRP or hyaluronic acid injection and or both? Typically, there's a period of a hiatus of up to 2 weeks, even longer at times. I've seen patients, but there's not really well established guidelines from a rehab standpoint, as these biologics are relatively new to the market. And additionally, even with the types of injections and the cocktails that are being injected, is that there's still a lot of heterogeneity with that. And I will say consistently with rehab, there are times where there's a lot of individuality, not only from one patient, but also from one clinician to the next. And so if the medical model doesn't have yet standardized protocols, then it's even more difficult for the rehab professionals also to establish protocols based off the biological cocktails that are being implemented. So that is currently the state of where we are at. Here is a proposal of how one may execute their exercise regimen thereafter. However, the discretion here is that it is often at the discretion of the injecting physician that is providing the treatment, the condition of the patient at hand, and why they're having the biological injection in the first place. But for this instance, we will move forward with an individual who has had the injection post arthroscopy, reconstruction of ACL, and other intra-articular pathologies, and they are well out from surgery. So the interventions for orientation of the table are listed here. The bold category, or the bolded, is the category of the exercise and how I classify them, and then the individual exercises are listed or bulleted there below. The frequency of how often each intervention should be taking place in a given week, ideally, and then arbitrarily 7 days of the week. So oftentimes low impact exercises are allowed, so walking, cycling, as long as the knee can bend greater than 110 degrees. Otherwise, you can use an upper extremity arm bike. Pool or deep water aqua jogging is often recommended, depending on usually these injections are non-invasive. Obviously, the injection site has to be well closed and well healed. Oftentimes, there may be even a couple weeks where specifically 2 weeks or so before you get into a pool, depending on infection risks and the immune system and resiliency of the individual. Accessory interventions that can go well: icing as needed, soft tissue, scar mobilization if they're post-operatively, and patella mobilization, making sure that the soft tissues and the mobility of the tissues and fascial tissue around the knee are doing well. Joint mobility, so knee extension. Again, if sometimes there can be a little bit of an inflammatory process that is after the PRP. That's really the mechanism of action that is intended, and thus with any inflammation there can be a loss of range of motion, both extension and flexion. Depending on how much range of motion is lost would determine the amount or the intensity of these different interventions of knee flexion and extension. Additionally, there would be muscle flexibility that would accompany this. Again, muscle stretching with isometrics at the end ranges are more potent and more effective than just passive exercises or stretching in themselves. And then quad-specific exercises would also be recommended. I've broken it down into day A and day B as really a modification from the traditional post-operative rehabilitation. The day A is non-weight bearing. It's open kinetic chain. Oftentimes it involves blood flow restriction training as well as NMES for approximately 20 minutes. And you are doing hip three-way. I'll describe that more as we go through this. And then there's 2 strength days that are with the utilization of blood flow restriction training, such that we're not putting too much stress on the joint, and with the accompanied with NMES. So the visuals of the knee mobility exercises are shown here. These are familiar from previous. I would certainly there's more. The intent of this video is not to go through each of the exercises, but rather to give a high-level overview of what would be entailed. Here's the day A, where you would do essentially a round robin of these different exercises of quad sets, hip abduction, adduction, hip extension, calf raises would be appropriate. The application of NMES and BFR would be recommended. As we move forward into like what would be those 2 strength days, so you could work into a single week of 2 strength days, or you could do a 2-week rotation. I'll show you examples of both. So you, with the sets and reps, you're going to allow the knee to prove itself, or whatever joint it may be, to prove itself worthy of doing more of higher loads, higher repetitions, higher volumes. So you can see the intensities listed here. This is unoccluded, but that means not with BFR. But if you were going to do any exercise with BFR, then your RPE scale would still be about a 7 out of 10. Notice the eccentric emphasis, so slow descent, pause at the bottom, 2-second concentric, and 1-second squeeze. And you can gradually, incrementally increase the volume per exercise as you go forward from level 1 to level 5. Again, spend a minimum of 2 weeks per level as a safe means or guideline. But again, checking in with the knee, the joint, whatever it may be, accordingly. Exercises for the gym would include usually a stationary bike. The treadmill, walking, and or elliptical is going to be at the discretion of your referring provider. You do that for approximately 5 to 15 minutes. We start off with some isometrics. So this would be your day 1 in this column. This would be day 2 in your second. You can see one day is labeled as knee, the other is labeled as hip, based off the exercise selection, but the macro scale of the workout is the same. Sets, repetitions are listed for each of the exercises accordingly. You can see the yellow highlight that the BFR option would include all those exercises that would potentially be symptomatic for the knee, or that would need to be tapered in regards to the weight. And your sets and repetitions for those given exercises would also change. It would be your traditional 75 repetitions of 30, 15, 15, 15. Whenever there is a quad dominant exercise, it is strongly recommended to use BFR and or NMES. A combination of the two would be recommended based off symptom to symptom or situation to situation basis. And then so this would be your week 1, where you do 2 days in the gym. Week 2 would be similar to that, with the exception that there would be a rotation of exercises. So we need some variability such that we get comprehensive development of the lower body musculature. That being said, too much variability fails to drive adaptation. As such, the macro scale of the workout is the same, and this would allow kind of that happy medium, that balance between variability of exercise, yet still allow for adequate consistency to improve the strength and the muscle, the same lines of tissue and muscles in question over the duration of the relatively acute period after the PRP injection, which should last anywhere between 4 to 6 weeks, maybe longer, but again, refer to your provider's recommendations for that specifically. Again, these exercises are, the intent of the video is not to go through the exercises at hand, but rather to give exemplars of what could potentially be done post the PRP and or hyaluronic acid injection. The middle supersets here are single leg biased. As such, those may need to be tapered if symptoms are not conducive to that just yet. So you could easily stratify this by simply just doing one superset here, another superset here, call it 4 exercises, and call it a day at the gym for your workout. Again, this is just an expansion of what is shown above with the day 1 and the day 2 here. I hope that helps to provide some guidance. If you have any additional questions, comments, concerns, obviously feel free to reach out. But yeah, it is not really well established as far as like what is the optimal protocol post PRP and hyaluronic acid injections.